If you want to avoid the sneezing and body aches associated with the flu, it's your time to grit your teeth and get that flu vaccine. The good news is this year there are some options that don't involve for some folks, scary needle. Joining us now with the essentials that you need to know, Dr. David Hansen. Dr. Hansen is a board-certified physician with Foxhall Internists. And good morning, first of all, to you. And registered nurse Pamela Prindle, the director of the Foxhall Internist Immunization Clinic. Good morning to you. Thanks so much for being with us. This is sort of news that we hear it every year, but boy, we also hear about illnesses and death related to the flu. This is a really big deal. Dr. Hansen, I'll start with you. Why is it important to get your flu shot, and what's new this year? Right.
Well, the flu, as we've been discussing, is one of the more serious viral infections. West Nile virus you're speaking about is something that is a serious public health issue as well. There's no vaccine for that, at least not yet. But for flu, there's a very effective vaccine that's been particularly effective the last few years here. So very important that everybody get vaccinated. More people that get vaccinated in the country, the less risk we actually have as a population in general, it turns out. So the CDC a few years ago recommended that everybody over the age of 6 months get vaccinated, with particular emphasis on the young children and the elderly, because they're at the relatively higher risk for flu as well.
Okay. We've heard in years past, too, that there's a shortage of vaccinations and all this. How are we doing this year? I'll ask you, Nurse Prindle.
We're doing great. I think everybody's got their flu shot early, their flu supply early. We've got more producers of flu vaccine than we had in the past, so that really helps with not having shortages.
Okay.
And we have a variety of different types of flu vaccines available for people, different ways to administer the flu.
And you brought some examples. I will in just a couple of minutes get my flu shot, but tell us what's new.
Well, the new one is this new intradermal by Adventis Pasteur, and it's for the needle phobics.
Yeah.
It's got a very, very short needle on it.
Oh, wow.
You can barely see it. It enters the skin very gently, and it's 1/10 of a cc that goes just under the skin.
Okay.
So Dr. Hansen and I both have taken this one, and I have to tell you that I find that it has less muscle soreness. You'll still have a little bump or a rash where the shot was given, but overall it's, I think, a less painful shot.
Okay. And Dr. Hansen, let's address that, because, you know, there are some folks out there that say, well, you're just giving me the flu, and I'm going to feel this. What should you expect after you get your vaccination?
Right. But the most important point to make is the idea that the flu shot can make you sick is completely false. There's actually nothing in any of these vaccines that's capable of introducing illness. Even the nasal vaccine is inactivated virus, so there's just no possibility of introducing infection. What you might expect is the immune system response to the vaccine, where you may feel aching, you may even feel a fever, particularly in the evening or the first 24 hours after the vaccine is given. But that's not infection. That's your immune system appropriately responding to the vaccine.
Okay.
So it's I think important to realize that although there are some people who are allergic to the vaccine, that's a fairly rare situation. Most really do benefit from having the vaccine.
Well, so let's get started. Nurse Prindle has agreed to do mine. Here is my consent form. We're doing this by the book here. There's that. I guess, Dr. Hansen, I'll just ask you so we can keep talking and I don't focus on what I'm actually doing here. You know, how long does it last? Some folks say, well, I'm going to wait to get my flu shot later, so it'll last longer. What's the real deal here?
Right. It's an older misconception as well, that if you get your flu shot too early in the season, then you may miss an opportunity to fight off infection later on. The vaccine will wear out, so to speak. Again, completely false. Getting a vaccine right now, as you're doing, is still going to be effective throughout the season in the DC area. Arguably, it's better to get it relatively early so that you have a chance for the vaccine to be fully effective by the time influenza reaches the DC area. So, short answer being that there's really no reason to delay at this point.
Okay.
And,
now, let me tell you something. I'm a pretty big baby. That was fine. Thank you so much. But you might also have the touch.
Yeah.
Okay. Been doing this for a while, right? Nurse Prindle, thank you so. Nurse Prindle, excuse me. Thank you so much for this and for coming in today. And it really is a painless way to do one thing that helps you keep moving this winter, right? This flu season.
It's a good idea.
All right. This is Dr. David Hansen. This is registered nurse Pamela Prindle, both from Foxhall Internists. Thank you so much for coming in today.